my name is Ty, and this is Alexis.
Hi, we're going to be doing some post-mortem care. If you guys want to step out of the room, now is your time to do that.
Okay, so we're going to start off with some hand hygiene, and we are going to put on our PPE, which include gloves, gown, and eyewear.
We would also be putting on a mask if we have them.
Yeah.
Okay.
So
We are going to identify our patient by their wristband, which has their name and date of birth, which is correct. So that is good.
Today our patient's organs will not be being donated, and there will also not be an autopsy. So we can proceed forward with our procedures.
So because there's not an autopsy, we can remove all of the IVs and any sort of line that they would have. So I'll take the IV out of the arm.
I'll take the catheter out. Okay. So after we have removed all lines and devices, we can now begin to go and check the eyes and the mouth. And
we would make sure the eyes are closed. We would close their eye using a wet cotton pad if their eyes didn't want to close easily. And then also
we'll inspect the mouth for the teeth. This patient did not have dentures, so that's not something that we would need to place back in. So we would just roll a towel underneath the chin to close the mouth.
To close the mouth, yes.
Okay. So now we will go and just place a pillow underneath the patient's
We
head.
just want to make sure the patient is looking presentable and comfortable, so a pillow under the head.
And they are in a supine position, and their body is positioned that is, viewable.
Right.
So
We would put their arms on their abdomen and just make sure that they are looking presentable.
and crossed.
And crossed.
Okay, so then we will now assess the facial hair to see if they need to be shaved. In this case, our patient does not have a lot of facial hair. And we will begin to use our basin with warm water and soap to wash the soiled areas of the body. So we would move from clean to dirty. So I'll wash the lower extremities. Okay.
We just want to make sure that there's no dirt or grime or feces on the patient.
Okay. And after they have been cleaned, we will now place an absorbent pad underneath them. So I will help you lift the patient up, place the absorbent pad. Okay, and then we will also put them in a clean gown at this point. So we will take off their old gown and just put them on a clean gown.
We would try to make sure that they are covered as much as possible at all times and make sure they still have their dignity and privacy.
Okay, so now at this point that the body has been positioned and cleaned, we can brush the hair. Okay, so we're also going to assess the body at this time for any patient belongings. The patient has on a ring, which the family said that they want to keep on the patient. And they also have on a necklace that will also be kept on. Everything else has been placed in a personal belonging bag and given to the family. Okay. So now at this time, we can allow the patient's family to view them.
Yeah, we will get the family and they can say their goodbyes. After they say their goodbyes, we will have the family leave the room.
Okay. So now we can remove all unnecessary medical equipment and we will place a clean sheet over the body. And once again, making sure that they keep their dignity. We are going to remove the linen and the gown, all linen and gowns. Yeah. And then we're going to place the body in a shroud.
So we would have a shroud, and we would remove everything from the patient per protocol and place them in a shroud.
Yeah.
And we would make sure that we have an identifier on top of the shroud.
Yep, and there will be about, I want to say 3 tags that identify the patient. So
we have 3
Yep.
different tags.
One on the lower extremity where we'll use the soft string in our shroud kit to attach to the body that identifies the patient. So after we are done, we will make sure that the patient is being promptly transported to the mortuary, and we will get ready to document that by removing our PPE.
We would make sure to document all of the processes, and especially all of the patient belongings that stayed with the patient and the patient belongings that went home with the family.
Okay. And then we can exit out of the room and wait for the body to be picked up. Okay.